Hello YouTube, I am Iamos the Satyr. You can usually find me on Twitch, but today I'm branching out a little bit into the YouTube sphere. Before we get into today's topic, I wanted to explain my citation methods throughout the video. Whenever a chart or graphic appears on screen, there will be an accompanying number at the bottom left corner. If there is no number, then there's something I have made myself or data I have collected by myself and not coming from a direct source. If I am talking about a statistic or fact, you might hear this sound. And a number will appear on the bottom right corner of the screen. All numbers correspond to my works cited page linked in the description below, so you can check directly where the facts are coming from. Now that that's all the way, let's get into the topic of our video. The United States stands out as one of the few industrialized nations that has yet to switch to a universal healthcare system. In fact, the United States is the only high-income country that does not have guaranteed healthcare coverage. There are many factors that go into play in how the United States healthcare system is lacking, and I will be going over 3 of the biggest components that I have identified through my research. If we were to go through all of the things that I found, we would be here much, much longer. So what we'll be talking about today is private insurance companies and their unchecked control over citizens' healthcare choices. This has also led into the United States having the most expensive healthcare in the world, pricing many people out of care and being a whole can of worms on its own, not even taking into account the private insurance. And without a governing body, many counties of the United States are considered healthcare deserts, areas of the United States lacking medical centers and specialists within an hour's driving distance. We will be going over each problem, how they affect people, the proposed solutions for them, and then how a universal healthcare system could help. So without further ado, let's get into problem number 1. The first issue with private insurance is acquiring it. In some areas of the United States, insurance not provided through employment can cost more than a person's rent. The price ranges from hundreds to thousands of dollars a month, all depending on a person's location, their health history, age, whether they have kids or not, and a myriad of other personal details that can make the price go up or down. In fact, 61 of those without insurance report that the reason is the price. Due to the price on its own being so high, many Americans rely on their employers to provide them with health insurance. This greatly limits their options to whatever insurance company and plans their employer have decided to provide. Choosing an insurance plan can be hard, as many plans are presented in the vaguest of terms, and there's no way to know for sure what is covered until you've already signed up. Another 21% of those without insurance reported that the reason for not having it was too difficult or confusing to sign up for. Once a decision has been made, Americans are locked into the insurance plan for an entire year, with only a handful of exceptions allowed. So if their medical needs change within that year, they cannot switch to an insurance that might cover their new needs until the year is up. I personally have been affected by this. I was on my employer's insurance plan for a number of years when suddenly they decided they would no longer cover ADHD treatment of any kind. When I went to re-sign up for the plan, there was no disclosure of this change anywhere. I didn't receive an email, there wasn't any changes on the plan paperwork, and I only found out after I went to get treatment and my claim was denied. I was stuck without my ADHD medication for a full year because I could not afford it without insurance. I could not even mention my ADHD to doctors because if they reported it in their paperwork that we talked about it, my appointment would not be covered, even if the majority of the appointment was spent talking about something else. There was nothing I could do but wait until next year to roll around and sign up for a different insurance policy and hope and pray that they did cover my ADHD. And I unfortunately am not the only person who has had to face this, and ADHD is not the only diagnosis that has been denied treatment by insurance companies. Luckily, my circumstances weren't that terrible. I had ADHD my entire life. I went unmedicated for the majority of my life. But it was still a very hard year and a very hard adjustment after being on my medication for so long and suddenly having to quit cold turkey. Unfortunately, getting insurance is only half the battle. Getting insurance to pay for things is a whole other ballpark. Insurance companies often have a list of pre-approved providers and a list of pre-approved types of care that determine what the insurance will pay for and what it will not. The list of pre-approved providers and pre-approved types of care can be hard to find and difficult to navigate. 28% of those with insurance report that they had to pay more for a treatment or service than expected. 17% of people experienced significant delays due to this. Another 17 did not receive recommended care that they needed at all. And 15% of people experienced a decline in health as a result of insurance interference. I know 28% and 17% don't seem like a lot, but these are people who are paying hundreds of dollars a month to access medical care and are being denied that access. They are paying into a system that is not working for them. If a person needs care that is not covered by insurance, they will have to pay the full amount of the treatment on their own, which is often thousands of dollars, and easily prices many people out of the care that they need. Insurance company employees who have never met patients before and often are not medically trained themselves decide if a procedure, tool, or medicine is really needed by the patient and approve or deny the care. It is a non-medical professional who knows nothing about patients making these decisions. While you can appeal these claims and ask insurance companies to reconsider, 45% of people who reported not starting an appeal process for a denied medical claim reported that they did not know they even had the right to do so. And almost 3 out of 5 adults who experienced a coverage denial said their care was delayed as a result. Medical care is often time sensitive, and delays in it can lead to worse outcomes. Insurance companies have complete control over access to care, and there is very few laws regulating them. Coverage denials are a way to keep insurance companies' costs low, paying for the least amount of care possible so they can pocket the unspent money. The current system is privatized and therefore profit motivated. Making money is prioritized over patient care, and a system built to give access to health care is routinely denying people access to it. If medical costs were affordable on their own, then people would not need insurance to help pay for their medical bills. Treatment without insurance often costs thousands of dollars, which makes insurance almost a mandatory requirement to accessing healthcare. But even with insurance, many Americans still worry about healthcare costs. 42% of Americans with insurance in 2024 reported worrying about the costs of their medical bills if they were to get sick or have an accident. The rate increases to 74% for those without insurance. 42% is nearly half. Nearly half of those with insurance still worry about medical costs, even though they have insurance which is supposed to help with those costs. And these worries are not unfounded. Nearly a third of people with health insurance report having problems paying for healthcare or prescription medication, and once again the number rises to over half of people without insurance reporting issues paying for healthcare, and still a third of them having issues paying for prescription medication. 44% of Americans with insurance report being in some form of medical debt, and the number spikes to 62% for those without insurance. Even with health insurance, the thing that is supposed to make healthcare affordable and accessible, nearly half of Americans report either worrying about medical costs or having debt because of medical costs. Now, there is an assumption that the high prices are justified because of the quality of care in the United States. We have the best medicine, the best doctors, the most cutting-edge technology, which would obviously cost more. But this is an assumption, and the US actually ranks below 30 countries in many public health indicators, including preventable deaths, infant survival, maternal mortality, and overall life expectancy. The United States has the highest national healthcare expenditure of any other country. We spend 17.8% of our GDP on healthcare, and yet do not even come close to being in the top 20 in public health indicators. Even if it could be proven that the United States has the best available care, it cannot help anybody if it is out of their price range. Many Americans report putting off appointments or treatments due to cost, which leads to worse medical outcomes. To bring my own personal experience into this, I paid $1,200 last year for doctor's appointments and medicine. This is a legit picture from my insurance plan explaining how much I spent in network, meaning on doctors and care that my insurance approved of. $1,200 a year doesn't seem that bad until you take into account that this is not counting any dental or vision care, because those are separate from general medical insurance, which is a whole other can of worms for another day. It also does not include what I paid to be insured, any over-the-counter medications I might have needed, any mobility aids, or any care that my insurance company refused to cover. This is also not counting any of my spouse's medical care. we pay $600 a month for health insurance, meaning our insurance and my in-network spending alone cost $8,400 a year. We are a two-person household that spends well over $8,400 for medical care a year. That's more than we pay in rent per year. Now, I am admittedly a little bit of an outlier. I have a lot of medical problems that result in me being disabled and needing more care than most people. But that is the problem. Disabled people like me who need care the most cannot afford it. It only takes one accident or a bad enough illness to become disabled and suddenly be unable to afford all the new medical care that you need. I am very, very fortunate to have a spouse who earns a very good salary and whose workplace provides them with good insurance options. If I did not have access to my spouse's insurance or financial support, I would not be able to afford the care I'm currently receiving. I was living paycheck to paycheck before they were able to help me, and I was also avoiding the doctor or taking medication when I needed it because of how much it costs. Medical cost that prices people out of care is not justifiable. This is not an optional thing. Healthcare is what keeps you alive, what keeps you mobile and, again, in good health. It is not something you can opt out of, and if you do, it often has dire consequences. Unfortunately, cost is not the only barrier to care. The final problem we'll be discussing today is healthcare deserts. This is one of the hardest parts to research simply because it isn't a problem that's given much attention. There is no one in charge of overseeing how many healthcare facilities are available to any given population of people, which means communities are often left to slip through the cracks. I removed myself from the screen and made this map as big as possible for everybody to see. A healthcare desert is defined as an area where healthcare facilities are an hour or more away from any given population. Many of these populations are rural. Most specialist clinics in rural areas either cannot afford to stay open due to lack of demand or cannot find doctors willing to work in low-income areas that would not pay as well as urban areas. Adding to this problem is an overall lack of primary care doctors. This lack of primary care doctors is because specialty doctors are paid more than general practitioners. So despite it being a vital role in receiving health care, there are simply not enough primary care doctors to go around. The map next to me displays how many types of care a county is missing. Types of care are categorized as pharmacies, primary care providers, hospitals, hospital beds, trauma centers, and low-cost healthcare centers. Dark blue, almost black, shows that a county is missing all 6 types of medical infrastructure. Navy blue is missing 5 out of 6, light blue is missing 4 out of 6, dark teal is missing 3 out of 6, light teal is missing 2 out of 6, light green is missing 1 out of 6, and gray counties are not missing any type of care. As you can see, most of the map is colored in. Many communities across the United States are not only priced out of care, but are not physically near enough to it. In previous sections, I have discussed how these problems have personally affected me, and I am fortunate to live in one of the gray areas. But this is not an accident. I deliberately moved to an area where all the medical care I needed was nearby. If I ever wanted to move again in the future, my options would be limited because of my medical issues. I would need to move to an area that for sure had all the specialists and general care that I needed, and as shown on this map, it is very slim pickings. This should not be a problem. People should not have to worry about moving into an area that doesn't have proper medical infrastructure. People already living in those areas should not have to drive more than an hour away for care, especially emergency care. It is heartbreaking that a lot of people don't have access to care, not only because of price, because it is simply not in their area. And there isn't any proposed solutions for this, and it's not given much attention simply because there is just a lack of oversight. No one person, organization, or even the government is in charge of making sure that healthcare is accessible to everybody, and so it is simply whatever county, whichever area is more profitable to be in, that is where the doctors are, leaving poor communities without that many people, like farmers, out to fend for themselves. These problems that I've been discussing throughout the essay are not unknown to the American people or their politicians, and so there have been a number of proposed solutions that might help, the first being insurance regulation. But this is often used as a buzzword. Whenever someone talks about insurance regulation, they don't often talk about exactly what those regulations would be and what they would do. Government regulations on business are also usually frowned upon by Americans due to cultural standards. No amount of regulation will change the fact that the current system prioritizes profit over patient outcomes. And what will be a recurring theme with all of these proposed solutions is they do not address healthcare desert. Another proposed solution is price transparency laws. We do have pre-existing price transparency laws on the books, but they are not very strict and not very well enforced. It is proposed that we could make them stricter and enforce them more often. This might help lower prices a little bit, but it does not give citizens the negotiation power that it sounds like it would. Price transparency laws would not address the fact that many citizens do not have the ability to choose their healthcare providers because their insurance plans only cover a certain number of doctors or even only one in the area. They might be able to compare prices between doctors, but they are ultimately only able to choose one of them. Nothing would stop these providers from setting prices too high across the board either. Price transparency laws do not address the larger issue of insurance companies having ultimate say over patients' healthcare and would not be effective in giving people informed choices because those choices are not often left up to them. And it again does nothing to address healthcare deserts. A third solution proposed is implementing AI technology to try and streamline care and services, so patients are not paying for unnecessary treatments. This too could help lower costs for patients. They would be paying for fewer services, but it would not lower the cost of care that they do need. They would still be paying the same amount for the care that is still required. While AI would be a helpful tool, it would not address the larger issue of the prices themselves, and again, does not address healthcare deserts. And even implementing all three of these changes would not do enough to change a system that is, again, for profit. None of these would make the motivation be patient outcome. It would just be putting band-aids on a gaping open wound and do nothing really to address the root of the problems. And again, none of these address healthcare deserts. There is no proposed solutions I have found at all for healthcare deserts. It is largely a very ignored problem. So I propose we do switch to a universal healthcare system. But, and I know this was coming the whole video, what about the cost? The biggest critique of a universal healthcare system in the US has yet to be addressed: the cost of implementing and maintaining that system. What people don't realize is that the United States government is already spending money on healthcare, more than any other country. The dark blue on this chart is each government's health expenditure per capita, meaning per person. The teal on top is what households in that country usually pay. The United States government pays roughly $10,587 per person, nearly doubling the next highest spender, which is Germany, at $6,542 per person. If the United States is running on a truly privatized system, then how is it spending so much? Well, because the system isn't truly privatized, it is heavily subsidized. Many hospitals and employer-provided health insurance are subsidized. There is also Medicare provided for the elderly and retired. When medical bills are left unpaid by patients, usually due to bankruptcy, it is taxpayer money that covers the bills. So how much money would it take to switch to a fully public healthcare system? $2,261 billion in taxes is already allocated to healthcare annually by the government. Well, the budget would have to increase by $773 billion to cover projected universal healthcare costs. It would be split between taxpayer households who would no longer be paying a collective $738 billion annually on insurance premiums and out-of-pocket costs, and businesses that on average pay a collective $536 billion annually to provide health insurance for their employees. Universal healthcare would overall be cheaper for Americans than the current system. It would require a raise in taxes, but you would no longer be spending money on insurance that doesn't work, and care prices would come down because it gives the government the ability to negotiate with providers and set prices. Right now, the current system flaws really stem from the fact that Americans don't have negotiation power in their own healthcare choices. They are unable to just choose another doctor to go to when prices get too high. They are unable to choose a different insurance if they've already picked one for the year. And insurance itself is so insanely expensive that they are stuck with the options their employers provide for them. So many of the United States healthcare problems stem from little oversight and no negotiation power. Publicizing the healthcare system would create oversight and concentrate negotiation power, making it possible for change. None of the current proposed solutions does enough on its own or even together to address the problems. Universal healthcare's only issue is its perceived cost, which isn't even as much as people think it would be. So, start petitioning for and voting for representatives who run on universal healthcare policies. Talk about it with family and friends. Post on social media. Make it so politicians can no longer ignore the rising problems and the obvious solution for it. We can make a better system for us and for future generations. We simply need to try. Thank you all so much for watching today. We're at the part of the video where I must now sell my soul to the devil by asking you to like, share, and subscribe. Leave a comment if you've learned anything new or have anything to add to the discussion. If you do not, tell me your favorite pet story. Let's try and lighten the mood a little bit, as I know this can be a little bit of a rough topic for most people. I hope you guys have a wonderful rest of your week, however long it takes us to meet again on the interwebs. Remember to drink water, take your meds if you have not yet today, eat good food, get good sleep, and I will see you all next time. Goodbye!